Living with diabetes, tips and tricks for managing your blood sugar. Diabetes is a chronic condition that affects millions of people worldwide. It is a metabolic disorder characterized by high blood sugar levels, either due to the body's inability to produce enough insulin or the body's inability to use insulin effectively. Diabetes can have a significant impact on daily life, as it requires constant monitoring of blood sugar levels, adherence to a healthy diet, regular exercise, and sometimes the use of medications or insulin. Understanding diabetes, what you need to know. Diabetes is classified into three main types: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is an autoimmune disease in which the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Type 2 diabetes is the most common form of diabetes and occurs when the body becomes resistant to insulin or does not produce enough insulin. Gestational diabetes occurs during pregnancy and usually resolves after childbirth. The exact causes of diabetes are not fully understood, but there are several risk factors that can increase a person's likelihood of developing the condition. These risk factors include genetics, obesity, sedentary lifestyle, poor diet, high blood pressure, and certain medical conditions such as polycystic ovary syndrome, PCOS. Symptoms of diabetes can vary depending on the type and severity of the condition. Common symptoms include frequent urination, excessive thirst, unexplained weight loss, increased hunger, fatigue, blurred vision, slow healing wounds, and frequent infections. If you experience any of these symptoms, it is important to see a healthcare professional for a proper diagnosis. The importance of monitoring your blood sugar levels. Monitoring blood sugar levels is crucial for managing diabetes effectively. Regular monitoring allows individuals to track their blood sugar levels and make necessary adjustments to their diet, exercise routine, and medication regimen. It helps to identify patterns and trends in blood sugar levels, which can help prevent complications and maintain optimal control. There are several methods of monitoring blood sugar levels, including self-monitoring of blood glucose (SMBG) using a glucometer, continuous glucose monitoring (CGM) systems, and laboratory tests. SMBG involves pricking the finger to obtain a small blood sample and using a glucometer to measure the blood sugar level. CGM systems use a small sensor inserted under the skin to continuously monitor blood sugar levels and provide real-time data. Laboratory tests, such as the A1C test, measure the average blood sugar levels over a period of 2 to 3 months. Interpreting and acting on blood sugar readings is essential for diabetes management. Target blood sugar levels may vary depending on individual factors such as age, overall health, and the presence of other medical conditions. It is important to work with a healthcare professional to establish personalized target ranges and develop a plan for managing blood sugar levels. If blood sugar levels are consistently outside the target range, adjustments may need to be made to the diet, exercise routine, or medication regimen. Healthy eating habits for managing diabetes. Diet plays a crucial role in managing diabetes. A healthy eating plan can help control blood sugar levels, manage weight, and reduce the risk of complications. The key is to focus on consuming nutrient-dense foods that are low in added sugars, saturated fats, and sodium. A balanced diet for diabetes management should include a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. Foods that are high in fiber, such as whole grains, legumes, and vegetables, can help regulate blood sugar levels and promote satiety. It is important to limit the intake of processed foods, sugary beverages, and foods high in saturated fats and sodium. Meal planning and portion control are essential for maintaining a healthy diet. Planning meals in advance can help ensure that they are balanced and meet individual nutritional needs. Portion control involves being mindful of serving sizes and avoiding overeating. It can be helpful to use measuring cups, food scales, or visual cues to estimate portion sizes. The role of exercise in controlling blood sugar. Regular exercise is beneficial for diabetes management as it helps improve insulin sensitivity, lower blood sugar levels, manage weight, and reduce the risk of complications. Exercise can also help improve cardiovascular health, increase energy levels, and reduce stress. There are different types of exercise that can be beneficial for individuals with diabetes. Aerobic exercises such as walking, jogging, swimming, or cycling help increase heart rate and improve cardiovascular fitness. Strength training exercises, such as lifting weights or using resistance bands, help build muscle mass and improve overall strength. Flexibility exercises, such as stretching, help improve range of motion and prevent injuries. The recommended frequency and duration of exercise may vary depending on individual factors such as age, overall health, and fitness level. It is important to start slowly and gradually increase the intensity and duration of exercise. It is also important to listen to your body and take breaks when needed. If you have any underlying medical conditions or concerns, it is advisable to consult with a healthcare professional before starting an exercise program. Medications and insulin. What you need to know. In addition to lifestyle modifications, medications and insulin may be prescribed to manage diabetes. Medications for diabetes include oral medications that help lower blood sugar levels and improve insulin sensitivity. Insulin is a hormone that helps regulate blood sugar levels by allowing glucose to enter the cells for energy. Insulin may be prescribed for individuals with type 1 diabetes or type 2 diabetes who cannot achieve adequate blood sugar control with oral medications alone. It is important to understand how medications and insulin work and follow the prescribed regimen. Some medications may need to be taken with meals, while others may need to be taken at specific times of the day. Insulin may be administered through injections or an insulin pump. It is important to learn proper injection techniques and storage guidelines for insulin. Like any medication, diabetes medications and insulin can have side effects. Common side effects may include nausea, diarrhea, weight gain, or low blood sugar, hypoglycemia. It is important to discuss any concerns or side effects with a healthcare professional. It is also important to monitor blood sugar levels regularly and adjust the medication regimen as needed. Coping with the emotional impact of diabetes. Living with diabetes can have a significant emotional impact. It can be challenging to manage the daily demands of monitoring blood sugar levels, adhering to a healthy diet, and taking medications or insulin. It is common for individuals with diabetes to experience stress, anxiety, and depression. It is important to acknowledge and address the emotional challenges of living with diabetes. Strategies for coping with stress, anxiety, and depression may include practicing relaxation techniques such as deep breathing or meditation, engaging in regular physical activity, seeking support from loved ones or support groups, and seeking professional help if needed. It can be helpful to communicate openly with loved ones about the challenges of living with diabetes and how they can provide support. It is important to educate family members and friends about diabetes and its management. They can play a crucial role in providing emotional support, helping with meal planning, and encouraging healthy lifestyle habits. Seeking support from healthcare professionals is also important. Diabetes educators, dietitians, and mental health professionals can provide guidance, education, and support for managing diabetes and coping with the emotional impact. Tips for managing diabetes at work or school. Managing diabetes in a professional or academic setting can present unique challenges. It is important to communicate with coworkers or classmates about your condition and any accommodations or support you may need. It may be helpful to educate them about diabetes and how they can assist in case of an emergency. It is important to have a plan in place for managing blood sugar levels during work or school hours. This may include packing healthy snacks, monitoring blood sugar levels regularly, and having access to necessary medications or supplies. It may be helpful to establish a routine for meals and snacks and communicate with supervisors or teachers about any necessary breaks or accommodations. Traveling with diabetes, preparing for the journey ahead. Traveling with diabetes requires some extra preparation and precautions. It is important to plan ahead and pack essential supplies, including medications, insulin, blood glucose monitoring devices, and emergency contact information. It may be helpful to carry a letter from a healthcare professional explaining the need for these supplies. It is important to have a plan for managing blood sugar levels while traveling. This may include monitoring blood sugar levels regularly, adjusting medication doses as needed, and having access to healthy food options. It is also important to stay hydrated and take breaks when needed. It is advisable to research healthcare facilities at your destination in case of any emergencies or unexpected situations. It may be helpful to carry a medical ID bracelet or card that indicates your condition and any allergies or medications you are taking. Navigating social situations with diabetes. Managing diabetes in social settings can present challenges, especially when it comes to food choices and alcohol consumption. It is important to communicate with friends and family about your dietary needs and any restrictions or limitations. It may be helpful to suggest alternative food options or offer to bring a dish that fits within your dietary requirements. It is important to monitor blood sugar levels regularly during social events and make adjustments as needed. It may be helpful to plan ahead and have healthy snacks available in case of low blood sugar. It is also important to stay hydrated and avoid excessive alcohol consumption, as it can affect blood sugar levels. It is important to remember that you are not alone in managing diabetes. There are many resources and support groups available that can provide guidance, education, and emotional support. Connecting with others who have diabetes can be empowering and help you navigate social situations more confidently. Staying motivated and positive while living with diabetes. Living with diabetes can be challenging, but maintaining a positive mindset is crucial for effective management. It is important to set realistic goals and celebrate successes along the way. Small achievements, such as reaching target blood sugar levels or sticking to a healthy eating plan, should be acknowledged and celebrated. It is important to stay motivated by focusing on the benefits of managing diabetes. Regular exercise, a healthy diet, and proper medication adherence can help prevent complications and improve overall health and well-being. It may be helpful to remind yourself of the positive impact that these lifestyle modifications can have on your quality of life. Learning from setbacks is also important. It is normal to experience occasional high or low blood sugar levels or deviations from the recommended diet or exercise routine. Instead of dwelling on these setbacks, it is important to learn from them and make necessary adjustments. It may be helpful to seek guidance from healthcare professionals or diabetes educators to develop strategies for preventing future setbacks. Managing diabetes requires a comprehensive approach that includes monitoring blood sugar levels, following a healthy diet, engaging in regular exercise, taking medications or insulin as prescribed, and addressing the emotional impact of the condition. It is important to seek support from healthcare professionals, loved ones, and support groups to navigate the challenges of living with diabetes. By understanding the basics of diabetes, monitoring blood sugar levels regularly, making healthy food choices, engaging in regular exercise, following medication regimens, and addressing the emotional impact of the condition, individuals with diabetes can effectively manage their condition and live a fulfilling life. With proper management and support, individuals with diabetes can lead healthy and active lives.